Hi there, my name is Susan, and I'm a second-year student in Gonzaga's F&P program. Hopefully you can see the little Japanese flower border that I picked out, but if not, I'm really sorry. It was cute. I'm a relatively new nurse as well. I have been an RN for less than 2 years, and so in a lot of ways, I'm still forming a lot of my ethics as an RN. A little bit about me. I currently work at the Swedish First Hill campus as a med-surg nurse, but I did start out as a brand new nurse in subacute and dementia care. A lot of my patients in that environment were elderly. A lot of them could not make decisions for themselves and had to defer to family or guardian. And it was in that experience that I kind of developed a real interest in patient autonomy. Now, that can be, I found, incredibly hard to determine in a lot of ways because you do want to do what's best for the patient and their physical well-being, but at the same time, you do want to keep their autonomy and their own right to have a say in their healthcare decisions. This becomes an even more gray area when a patient isn't fully capable of making decisions, not just elderly. It could be a minor, it could be a disabled individual. And so that is something that I've been trying to focus on in my first couple years as a nurse. One way that I try to focus on giving a patient an autonomy over their own healthcare decisions is I try to provide as much education as I can, especially regarding medications and pathophysiology. When I go into a room after I've gotten the first checks and the introductions and such done, when I do my assessment, I explain to the patient before, during, and after the assessment of what I'm looking for, what I'm going to do, and why I am looking at this particular assessment. For instance, when I have a post-surgical patient, I tell them one thing I do want to do is I want to lightly palpate your stomach. I'm going to go first shallow, then medium, then deep. What I want to do is I want to check for any inflammation. I want to check for any hardness, to check for bleeding. That's just an example of many things. And with medications, that is a huge pet peeve of mine because in my own experience, when I had family members in the hospital many, many years ago, a lot of healthcare providers would prescribe things and I'd never tell my family members what they were getting, and nurses would just come in, not all of them, they would come in and just push something through a family member's IV and not tell them what it was, and that was very disturbing to me because I believe every patient has a right to know what is being done and why and what the goal is, and they have the right to refuse that for whatever reason is important to them. So one thing I do is I always go in, I tell them what medication they're getting, what the medication does, its mechanism of action, when it should take effect, and some side effects that could happen. And I welcome questions. I love answering questions because one of the things I do love about nursing is being able to pass the education that I've been privileged to have onto other people who have not been trained, because I feel that's what we as nurses are there to do. And part of our advocating for the patient is giving them all the information that they need to make an informed decision about their health care. So right now, that is the main focus of my role as a nurse, and that drives a lot of my ethics, is mostly patient-centered. I hope in this course to develop an even broader horizon as far as ethics, to modify some of my own ethics or expand on them, and to develop a whole new set of in-depth ethics. I'm really excited for this course, and I look forward to working with each and every one of you. Thanks, and have a good day. Bye-bye now.